The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, and welcome to Aging Horizons. We're approaching the end of summer, mid-August, and it's time to evaluate how your Medicare plan has been serving you. As we are approaching the open enrollment period, you need to evaluate where you are, what you've been doing, and how well your plan has been serving you. Plus, there's still time to take advantage of some of the Medicare options, so stay tuned.
With as many as 1 in 10 Americans at risk for Alzheimer's or some other form of dementia, chances are someone you know and love will receive that diagnosis. When that happens, you may well feel devastated, but know that you are not alone. Help is available. You don't have to face dementia by yourself. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
It's been 27 years. I never thought I'd still be smoking, but here I am, COPD and all. I'm about to have a granddaughter. There's so much to show her, but I'm scared I won't be able to keep up like I used to. I kind of gave up on myself on quitting. But it's different now. I want to be here for her and for my daughter.
When I stopped showing up, Jim showed up at my door. He took me to the hospital in town to get me help. That's the day Jim saved my life.
Everyone has a role to play in preventing suicide. Know the signs and don't be afraid to speak up. If someone you know is in crisis or emotional distress, the only wrong thing to say is nothing at all. Call 800-273-TALK or text MT to 741-741.
Every generation produces heroes, men and women who step forward to defend our country in time of need, no matter the personal cost to themselves. And though we can never fully repay them, we can make sure they have access to low-cost, long-term care when they need it. That's what Montana's Veterans Homes are all about. If you've got a hero in need in your family, call us. We can help.
Hi folks, and welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Brian Lamore. I mentioned in the opening we'll be talking about preventative services that are available for Medicare, and we'll be talking about how you can evaluate how Medicare has been treating you this year, because we have an open enrollment period coming up a little later in the year. Of course, we have a wonderful guest. We have Kimmy Everman, your Special Projects Person with the Department of Public Health and Human Services. Welcome to your show.
Thanks, Brian. It's always good to be here.
Yes. And as we always do, we start with the ABCDs of Medicare, so our viewers can understand or have a baseline of what we're talking about. What are they?
You know, I think it's really important that people know the lay of the land before we talk anything about signing up for anything.
Yes.
Because you need to have a firm idea in your head of what it is you want, what it is you don't want, and where you hope to go in the next year. So this is a good time to just start reaching back and looking at the year and thinking about what you liked, what wasn't so great, and so on. Now, our Medicare beneficiaries, they have they have a coverage that is, I think it's a great coverage, but there are different ways that you can choose to get that coverage. And so one of the things that I like to explain is the A, B, C, and D, which is the different portions or segments of Medicare. So Part A is your hospitalization, your major medical, excuse me, Brian, it's sometimes called your catastrophic coverage, but it's for when you have to go to the hospital. Maybe you've been seriously ill or in an accident. Part B then is just the kind of opposite. It's for your outpatient sorts of services. So you go to a clinic and see your doctor, and you may have some tests done and that sort of thing. Part B comes in there. I'm just going to, as folks know, skip past C for just a minute and go to D. Part D then is easy because it's the drug piece of Medicare. And even though, gosh, it's 15 years old or so now, I always say it's the newest piece to Medicare because it takes a long time sometimes to get those things to come together.
Yes.
And we're so happy to have it because it's changed so many lives in terms of being able to afford medicine and take it in appropriate ways, etc. So Part D, very, very important. All right. So if you have A, B, and D, you are on what's called the traditional plan or the traditional model of Medicare. Now let's go back and talk about C for a minute. C is a combination of A, B, and D. So instead of having 3 parts, you simply have 1. And what I mean by that is we call it a one-stop shop, if that helps the person sort of visualize it. The place that you might get that Part C, the company, is going to provide your Part A services, your Part B services, and your Part D services, and they'll have a sort of network that you'll work within. If you're in the traditional model, the A, B, and D, you can go to any doctor that sees or that accepts Medicare, and you can go to any pharmacy that accepts the Medicare Part D coverage. And you know, in this day and age, that's almost everyone, pharmacy-wise. The Part A, or excuse me, the original Medicare being accepted by every single doctor might not always be true. So that's one of the places where a person is going to, again, when they're thinking about, wow, how did I like how my medical care went this past year? When you're thinking about that, think about, was it hard to find a doctor who takes my Medicare coverage? Did I have to give up a doctor I liked because they didn't take Medicare anymore? So it's important to definitely check into those things. And then along with the Medicare model we just spoke about, we have some helping programs that assist folks to pay some of those premiums and out-of-pocket expenses, and we're going to talk about those a little bit later. There's also something called supplemental insurance that you can buy that goes along with your traditional model of Medicare. And again, we can talk about that a little bit later, but there's a lot of different options, so it's very important that the beneficiary spend time looking, thinking, educating themselves to know exactly what they're supposed to be able to get, and then go forward and find that in the plan that works for them. And SHIP counselors, I gotta say, it's the perfect place to stop because SHIP counselors, they're the ones that are going to help with that.
And the 800 number that's on the screen, it's important to know that they don't have anything to sell.
Right.
They're professionals, they're in your community, and they can help you.
Right. They are awesome. They are very, very knowledgeable and always are there to support and advocate.
And when you give them a call, you might have to make an appointment to talk to them, but it's important to know what you want and generalize. You can maybe say, this isn't being covered, should this be covered? And they can research that for you.
They know so much about these plans. It just makes me I'm awestruck.
That's great. And for our viewers, again, that 800 number, it's important to know that they don't have anything off the shelf to sell you. They're there purely to help you. You might even know them, maybe not. But we'll have more information on that in just a moment, so stay tuned.
think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Summer in Montana is a great time to visit your local farmer's market. Enjoy the social atmosphere while shopping for a wide variety of fresh, locally grown produce. Together with both WIC and Senior Farmers Market nutrition programs, you help feed your family 5 or more daily servings of fruits and vegetables for better health. You also help local ag producers and enhance the state's economy. So, for summer fun that's nutritious and helps Montana's economy, shop at your local farmers market.
Sergeant Jones. Please respond. I was separated from my squad. Requesting backup. Anyone? Please respond. I'm all alone here.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Hi, folks, and welcome back to Aging Horizons. I'm your host, Brian Lamore. In our prior segment, we were talking about the ABCDs of Medicare. Well, A, B, C, and D is traditional Medicare. Part C is provided by the private sector insurance companies. And Kimmy, let's talk a little bit more about some of the additional benefits you can get under a Part C that isn't a part of your traditional Medicare.
Sure. You know, Medicare Advantage is called that for a reason. Mm-hmm. And the reason is that you may find a plan that has a few maybe expanded services that you might not get under the traditional model. Mm-hmm. For instance, optical. You know, we know that unfortunately Medicare, the traditional, doesn't cover eyeglasses. Mm-hmm. So that's a really nice benefit if you're a person who wears glasses. Hearing aids is mm-hmm. another. Dental is another. Mm-hmm. And, you know, then there's other things like health club memberships and things like that. And I don't think those are as important as the first that we just discussed, mm-hmm. because, you know, it's easy to get, we don't want people to make decisions based on a health club membership. Right. However, dental, gosh, that could be really, really huge in your life. And so a Medicare Advantage plan brings to the table some different options for you that traditional Medicare may not cover. And it also, the thing about those, however, is I want to just caution everyone to, when they're looking for that, to make sure you understand how much that benefit is. And let's go with dental for a minute. You know, I don't know what, say, a basic cleaning costs at the dentist's office, but let's just say it's $300, mm-hmm. okay? What if your dental benefit under the Medicare Advantage is only $100? You're probably going to have to work something out there. You may not be able to see that dentist. They may not take that. Right. So there's issues with it that you just want to make sure that you educate yourself prior. Because I'm in no way saying that that's a bad thing. You know, older adults need dental services mm-hmm. and, you know, optical and such. So this is a great way to get it. Just know what you're getting.
You have to be aware.
Exactly. And these are also called Medicare health plans. So you may hear them referred to as both of those names, but that's what those are. And that's another time when talking to a SHIP counselor can really be beneficial. They know so much about these plans. And frankly, if you want to get yourself a little bit ahead, go online first. Google the name of whatever plan you're thinking about, signing up for, and take a look yourself. Make some questions, and then talk to the SHIP counselor, and they will be able to answer your questions. If not, they'll find out for you.
And an important aspect of the healthcare, the SHIP counselors we call them, is that there's some helping programs that are out there.
Yes.
We have costs associated with Medicare. I mean, Part A I think is covered, but B and D are additional costs. And these helping programs, there's a number of them. You might be eligible for some, maybe all. You don't know. The SHIP counselors do. What do the helping programs do?
Well, I always start out with saying, what have you got to lose?
Yeah.
Because all you have to do is some very short question answer type of thing, and then you're on your way and seeing if you're going to be eligible. I think it's important to know that you're right. Part A comes at no premium for most people because they work for their adult life and they pay into that, so they get that premium for each month. But B absolutely has a premium each month and a deductible, and in many cases so does Part D and Part C actually. So it's important to know where those out-of-pocket costs are going to land when it comes to your own financial situation. We do have helping programs. One is called the Medicare Savings Program, and that's for your Part B, that outpatient. It helps pay for the out-of-pocket expenses for a lot of folks, deductible, the monthly premium, and just really wraps around that service. Very, very good program. And then we also have low-income subsidy, which is for Part D, which is the drug coverage, and again helps cover deductibles, premiums, out-of-pocket expenses you might not be able to cover yourself. What you want to do is not think right away, oh, I have a house, so I must not be eligible. No, you want to call the SHIP counselor at the number that we've got on the screen and talk with them about your situation. And if you're not eligible for those, maybe there's something else. We also have Big Sky RX, which is for older adults and their medication that is a slightly, you can have slightly more resources. So, there's, and the SHIP counselor is going to know just about connections in the community.
Well, they're senior advocates, and that's a broad topic. And there's other programs out there that our area agencies on aging and our seniors provide to seniors, which I know the legal services program is kind of nice. They help prepare my will and everything.
Exactly. You just don't know what you're going to run into that I need that.
And you offer that? That's great.
We're a well-kept secret, and we want everybody to know.
And it all starts with a telephone call to the 1-800 number that's on the screen. Aging Services, or the area agencies on aging, are there to advocate for individuals over age 60 plus certain individuals with disabilities. We'll be talking more about that and some other programs that are available, particularly preventative services available through Medicare, in our next segment. Stay tuned.
Montana's fighting COVID-19, and if we want to stay open, we should all listen to the experts and mask up, especially when we can't social distance.
We want our students in class and sports back this fall, but we've got work to do. One proven path to slow COVID-19 is to mask up.
We're wearing our masks.
And our players are too.
I'm wearing my mask to protect you.
Will you wear yours to protect me?
Mask up, Montana.
I was diagnosed with diabetes in 1992, and I went into denial. It made me angry. I was a professional chef, and I didn't want to change my eating style. It took me a long time to get serious about managing my health. My perspective changed from resentment to one of loving my body, the container for my spirit. Getting help from my diabetes educator supported my goals of improved self-care. I want to feel good and have a great life. My diabetes educator helps me do this.
Good care is your right. In Montana, there's over 11,000 beds in nursing homes and assisted living facilities. If you or a family member needs assistance or help in obtaining information about care issues and placement options, call 1-800-332-2272. If you or a family member need information about Montana's long-term care resident rights, or if you need help solving a problem or a complaint about a nursing home or an assisted living facility, call us at 800-332-2272.
If you give or receive care, you already know that it can cause stress on caregiver and receiver alike. The good news is, if you have limited resources, help is available. The Montana Lifespan Respite Program may be able to help you pay for care while you take a break. Even better news is how easy it is to apply. You can get an application online or have one sent to you. We'll get back to you within 5 working days. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
Hi folks, and welcome back to Aging Horizons. I'm your host, Brian Lamore. And as we continue our discussion about Medicare, we want to talk about the preventative programs. They want to keep you healthy, and there's 28 different types of preventative benefits that are available under Medicare. And Kimmy, why is preventative programs so important to our senior population?
Well, you know, Brian, as we can both attest because we age,
Yeah.
we see that things change with our bodies, both physically and mentally over the years. And there are things that if we maybe look at it at the very beginning of that thing starting, you're more able to live with it, cope with it throughout the rest of your years. And you know, I guess I'm trying to be careful because these things aren't all bad.
No.
Changing as we age is not all bad, but there are things that you're gonna see change that you just kind of, I always just go, I can't
What
believe
next?
that's going to. But I think proactive is always a better position than reactive. Proactive gives us time and calm to figure out a problem. Reactive is, you're running around with your chicken with your head cut off because you don't know what to do and there's no time. And so obviously we want to pick the first option. And those, so those approximately 28 different services are, a mammogram, immunizations, colonoscopy, things that perhaps we don't get thrilled that we have to go do them. Who would? However, they are such a good baseline to tell a doctor and you what's going on with your health. And so Medicare has chosen this list of what I think is a pretty fine list. I wish I would have brought the list today, but folks can just Google Medicare preventive services and that list will come up everywhere and you'll get to see what's all on there. But I think Medicare has put together a really fine menu of what preventive services are most important and that we really need. And I think in this time we've had this whole show, we haven't talked about COVID once, but we will for a minute and just say that this is a time when we have to be extra careful to make sure our health is okay, especially if you have another person in your home that might be high risk. So many of us are high risk just because of our age now. So it's important that you keep up on those preventive services. And I would say that this is the time of year where if you haven't done the ones that you thought, okay, in January, my resolution is to do ABC. If you haven't done them yet, now you still have time.
Yeah.
You know, as we were talking off camera, you mentioned these are the months when appointments fill up fast.
Yes.
And you cannot get in because everybody has the same idea. But we want you to be thinking about, okay, I'm going to take a look at that list. Is there anything I should do to better define my health to myself and my doctor, and give me more information to use when I decide for enrolling next year.
Next year. And one of the first, I think, benefits of the preventative health care is the wellness checkup. You do that every year.
Yes.
You know, I
Brian,
did mine,
yep.
and, you know, they go over everything. Is something changed? Is something new? Is something better? The best time to catch a health issue is early, is when the medical professions can start to address it.
Exactly. That's so true. I'm so glad that you mentioned the wellness visit, because the Welcome to Medicare and then the wellness visit hand in hand, so important. Probably the most critical two pieces of that preventive services menu, because it gets you started. You know, and we've talked so many times, this isn't a camp physical. This is a long, in-depth discussion with a doctor about your health, your history, and where you want to go into the future.
And you know, you mentioned that some of these benefits that you have requires a doctor's appointment, and as we draw to the end of the year, if you're trying to get an appointment in November and December, they're usually booked up. You want to do those now.
Yeah, I completely agree. And if you don't know what you need to do, call and talk to the nurses at your doctor's office. They're happy to help you figure out what you need to do next if you don't know. You know, I want to give one more shout out to those SHIP counselors too before we go today, Brian, because they are just absolutely a critical piece to this puzzle of getting through Medicare and health care for older adults. They have so much knowledge, and if they don't know what you're trying to find out, they know how to find out, which is another huge step in the right direction. So let's make sure we put that number up on the screen again, and really encourage folks, call your local SHIP counselor. They want to talk to you, and they really, really do.
They really do. And they have access to other programs that you might want. Meals on Wheels, senior center services. Socialization is so important for seniors, but it's more difficult now with the COVID.
It is, yep.
But they're aware of the issues that are hitting individuals who are over age 60 and on Medicare.
Right, and they're, you know, as you said earlier, they may be a friend of yours from your community. It could very well be, or they may not. But at the end of the day, they are a person in your community who wants to help support you. And so we really encourage folks to call their area agency, talk to their SHIP counselor or their INA technician, and just get everything in terms of information that they can get.
That's great. Well, Kimmy, thank you so much for coming on your show today.
Yeah, sure thing.
And again, for our viewers, to kind of recap, those SHIP counselors, they are very confidential. Even if you know the person, they are not going to tell anybody about the issues that you brought up. And they're a great resource for a variety of programs that individuals age 60 plus can access. For Aging Horizons, I'm Brian Lamore. Thank you for joining us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.